Hi, my name is Jeanette Coffey, and this is the Language of Anatomy video assignment for week 1. And I'm just going to turn our attention to our skeletal structure here. And the very first is body regions and anatomical terminology. The first is hallux, which is your big toe. It's going to be right here. Your axillary, which is your armpit area, right here. Your buccal, which is your cheek area, right here. Your pollex, which is your thumb, right here. Patellar, your kneecap. Oral is your mouth. And your mental, chin area. Your brachial, which is your arm. Your antebrachial, which is your forearm. And your crural, which is your leg. Umbilical is your navel area. It would be in this section here. And your femoral, which is your thigh. Your calcaneal, which is your heel. Let's turn this around. It would be your heel area right here. And your popliteal, which is behind your knee. It's your hollow area here. Olecranon, which is your elbow right here. And your acromial, which is your point of your shoulder here. And your occipital, which is the base of your skull right here. The next part of this video is directional terms. So your head is superior to the sternum, which means your head is higher than the sternum. Here's your sternum area, it's higher. The olecranon is distal to the acromion, and your elbow, meaning your elbow, is distal to the shoulder. Elbow is distal to the shoulder. The axilla is proximal to the brachium, which is your armpit area, is distal to the shoulder. It's distal to the arm here. And the nose is medial to the eyes, which means it's in the middle, the nose area to the eyes. And the elbow is proximal to the carpus, which is your elbow, is proximal to the wrist area. So the sternum is anterior to the vertebral column. Your sternum here is before the vertebral column here. And the umbilicus is inferior to the sternum. So your umbilicus is lower than the sternum. So sternum here, umbilicus here. It's lower. The patellar is proximal to the tarsus. So the patellar is the kneecap here. It's proximal to the tarsus, which is your foot, a bone in your foot. The eyes are lateral to the nose. The ears are lateral to the nose, which means aside from the nose. So here's your nose, and it's to the side. Lateral. Now I'm going to divide the body into the 9 abdominal pelvic regions. So I'm just going to take some athletic tape here. And I'm going to go from the mid clavicle area to about the groin here. And then I'll divide it underneath the ribs. And one by the hips. So I've split up now in 9 regions. 1, 2, 3, 4, 5, 6, 7, 8, 9. So this region here is going to be our right hypochondriatic region here, and you'll find your liver and your bladder in that region. Your epigastric region here in the middle, you'll find your liver and your stomach. And the left hypochondriatic region here, you'll locate some of your stomach, your spleen, and diaphragm. And now we'll move on to the right lumbar region. You'll find your large intestine and your kidney in that region. Your umbilical region, you'll find your large intestine, small intestine, and pancreas. In the left lumbar region, you'll find your large intestine, small intestine, and kidney. And here you'll have your right iliac region. You'll find your appendix and your cecum in that region. And here in the middle, your hypogastric region, you'll find your rectum and your urinary bladder. And here to the left iliac region, you'll have your small intestines and sigmoid colon. Sigmoid colon in that region. And that completes our video. Thank you.